everyone, Dr. Greg here again for Greg TV channel. So I would like to welcome you again and thank you for watching my videos. Don't forget to click the subscribe button and click the notification bell so that you will be informed immediately every time I come up with a new video. Okay? So now my topic is on the coronavirus and the tests on how to detect the presence of this infection. Okay, so let's continue with this video. If you were exposed to the virus, after 7 days your body will produce a certain type of antibodies to fight the virus. So the first antibody that will be produced by your body to fight the virus is what we call the IgM, and it appears on your blood on the 5th to 7th day if you were infected. After 14 days, another type of antibody which will fight the virus will appear in your blood, and is produced by your immune system. This antibody is the IgG. Okay? So this is a more potent antibody which usually produces a long-lasting protection and fights off the virus more aggressively than the IgM. So if you don't know, we have two tests available. The first test is what we call the rapid antibody testing. Okay. So what is this rapid antibody testing? Okay. The rapid antibody testing kit is a kit with reagents that is designed to detect the presence in the blood of antibodies. Okay. So let me say it again. The antibody test kit, the rapid antibody test kit, is a test kit. It looks like a pregnancy test kit, and the purpose of this kit is to detect the presence of antibodies in your blood. So all it takes is 1 to 2 drops of your blood, and it will detect whether your body has antibodies for the coronavirus. Okay. So what does that mean? It means that the rapid antibody test kit does not detect or does not look for the virus. So it is designed to determine whether the body has produced antibodies or not. Okay. So what's the other test? The other test is the RT-PCR. What does that mean? The RT-PCR means real-time polymerase chain reaction. This is a test wherein you get a sample from your body fluids, which is the most accessible is the nasal discharge or the nasal secretions. That's why the sample that we get for RT-PCR is a nasal swab. So this is a cotton pledget that is inserted inside your nose all the way through the back in the nasopharynx area to get samples of your nasal secretions. So once you get the nasal secretions, you send it to the laboratory. And after they have processed the specimen and filtered out impurities, then that's the time they will mix the specimen with certain reagents in the hope of replicating proteins of the virus. So let me say that again. The RT-PCR will need a sample from you. So the sample is taken from the nose or the mouth, and that sample is taken to the laboratory so that this sample will be filtered and to determine whether virus particles or proteins are present. So even the smallest amount of protein inside will be detected. How? Proteins, or if ever there is viral RNA present, if mixed with certain reagents, the chemical reaction will be to replicate the RNA or the protein of the virus itself. So this process will take time. So the viral RNA will be replicated into millions of copies, and these copies will be tagged with a marker. And if there are already several million copies of the virus marked, this will be placed in a chamber and be measured. So once a virus is present, there will be millions of copies of this virus that will be replicated and marked and tagged, and will come up positive in the chamber once read. So if you are positive with the RT-PCR, that means you have the actual virus inside your nose and your body. So that is the difference between an RT-PCR and a rapid antibody test. So the real-time polymerase chain reaction detects for the presence of the virus, while the rapid antibody testing detects for the presence of antibodies. So those are two different tests. So if you do a rapid test screening and the patient has no symptoms but is positive for the IgM and IgG, then it means the patient has been exposed to the virus. So because the body has produced antibodies. As in contrast with the RT-PCR, if you're positive with the RT-PCR, then you have the virus, actual virus inside you, because the gold standard for testing for the presence of the coronavirus is still currently the real-time polymerase chain reaction, or RT-PCR for some. But I hope this video will enlighten you on the difference of the two tests, because people think that if you're positive with the rapid test, you have the virus, whereas in fact when you're positive with the rapid test, that means you have recovered. More with if you have the IgG positive, then that means the virus might be no longer inside you, but you are already protected, so you have the antibodies. As compared to the RT-PCR, when you are positive with the RT-PCR, it detects the virus inside of you. So if you are positive, then you are contagious. So beware. So if you have to test for the virus itself, you request for an RT-PCR. If you want to screen people without symptoms and you don't know if they have been exposed, you can do the rapid antibody testing. But this rapid antibody testing is just an aid, so it will only help you guide yourself to decision making and to know whether patients have been exposed or not, how long have they been exposed, or if they have been exposed recently or more than 2 weeks. So that is what the rapid antibody test will give you. Okay? So if you have a combination of the RT-PCR and the rapid antibody test, that will give you a more accurate picture of the patient. Okay? So with that, I hope you have learned something new, and I would like to remind you again to please subscribe to my channel, click the notification bell, so that every time I come up with another video, you will be the first to get notified. Okay? And I hope you learn a lot from my next videos, and please comment on my comment box below if you want me to feature a specific illness or disease that you might want to learn from. So again, thank you for watching my videos, and I hope to see you again next time. Bye bye.